So just realize this is going to come across as me bashing Costco. All right, whatever. Hey guys, welcome back to the DrCliffAuD vlog. This is vlog number 137, and today I want to talk to you about a patient that I saw who came over from Costco, kind of a situation going on there, so I'll fill you in on that. But before I do, if you could do me a huge favor, click that like button, really helps out the channel. And if you are not yet subscribed, go ahead and hit that subscribe button with notification bell so you get notified every single time I post a new video. But with that out of the way, I really appreciate it. Now, before I get into this whole Costco thing, I just want to give you an update on the podcast this last week. So if you are unaware at this point, we have a video podcast that airs live every Wednesday at 4 p.m. Arizona time. Keep in mind, Arizona time zone never changes. So if you have daylight savings and all that stuff, times will change for you, not for us. But that being said, the podcast went way better this week. Now, I talked in my vlog last week of how horrifically bad the podcast went a week ago. But this week's it was actually really good. In fact, the only real issues that we had were, number one, if you watch the podcast, the Dr. Cliff Show, you'll notice that the intro had a lot of music and it was really loud, and it was actually, the music was covering up what I was saying, so that was not a good thing. I did have it closed captioned, and I had to type the closed captions myself because even the closed captioners could not figure out what I was saying at the beginning, but make sure that you watch it with closed captions on. The other thing is that the interview that we had with Dr. Alturi, who is an audiologist out at the Villages in Florida, we did not get good audio from him. And I think the issue was not the internet connection on his end. I think that he was basically using his phone, and because the microphone and the speaker are very close to each other, the phone was clipping his voice or cutting out his voice because it was detecting feedback. So I think that was what the issue was. So now we have to make sure that every single guest that we bring onto the podcast, that they are not on their phone, that they're actually on a computer, or they actually use a headset or AirPods or something like that to prevent the feedback issues. But all in all, like, we're getting better as weeks go on. Me and Dr. Cook are definitely in a good groove together. Kelsey Beck, my extern, my audiology resident, she's been fantastic. We keep bringing her back on the show because she's really good with monitoring your guys' comments and asking questions of us during the Q&A time. So make sure that you guys are tuning in to that podcast so you can ask your questions as well. All right, so now that we have that out of the way, I do want to talk about a patient who came in today. Now, as you guys know, I talk, a decent amount about Costco, but nothing crazy. I have videos where I'm talking about, great things about Costco, and I'm talking about some things that are not great about Costco, and then a couple things that are kind of neutral about Costco. Now, I know that anytime I say something great about Costco, I get hearing care professionals mad at me, and every time I say something negative about Costco, everyone who loves Costco gets mad at me. So I get it. If you guys want to say something mean about me, I'm totally cool with it now. After doing this for 5 years, you can say whatever you want, doesn't bother me. So let's go ahead and get right into it. So I had a patient come in, and this patient was very open about, like, listen, I have hearing difficulty. It's been bothering me for nearly 20 years at this point. Now I'm starting to worry that it's messing with my cognition and all of that because I feel like I can't, multitask and do things as efficiently as I used to. And so, and dementia runs in the family, hearing loss runs in the family. So now it's becoming more of a concern. So this individual had gone to a private clinic and had also gone to Costco. And so both of the audiograms that she brought in, both of them were, okay, there's a hearing loss here. And I'll actually put it up here on the screen. This is the hearing loss from a threshold perspective of this individual. You can see that we have a normal hearing sloping down to moderate level hearing loss and normal hearing sloping down to moderately severe. And relatively symmetrical, a little bit of asymmetry there in the high frequency ranges, but all in all, we have a hearing loss here as a primarily high frequency sensorineural sloping hearing loss. Now, this particular type of hearing loss, the individuals that have this type of hearing loss typically report that they can hear that people are talking because they get the low frequency speech components that give perception of volume. but they don't get the high frequency clarity components, which are the consonant sounds that give them perception of clarity in speech. So they always say, well, I can hear people talking, just can't understand what they're saying. It's kind of like trying to solve a Wheel of Fortune board with a lot of the letters missing that prevent you from understanding exactly what it is. You might guess that you know what that phrase is, and then sometimes you guess right, sometimes you guess wrong. Well, that is basically what this individual is going through on a constant basis. And all of this is being corroborated by her husband, who is like, yeah, she keeps asking for repetition all the time. She just responds with responses that are nothing what she was asked, or things like that, right? All the telltale things of, not being able to understand speech if there's background noise, because anyway, it's a whole thing. This individual is having a lot of hearing difficulty. And so the thing is that she had went to the private practice clinic and was like, okay, that was a horrible experience, so I'm gonna go to Costco because I've heard positive things about Costco. Individual goes to Costco, they do this hearing test on her and they say, yeah, you're kind of borderline for even needing a hearing aid. We wouldn't really recommend it, but if you really want to try one, we'll program a set really quick. We'll put them in your ears and you can go walk around the warehouse. Well, she goes and does that, and it is absolutely a horrible experience for her. Anytime that hearing aids are fit and you're not following best practices when programming the hearing aids, you have no idea what someone is getting. So to put someone in a set of just auto-fit hearing aids and having them go to a, I don't know, acoustically unfavorable environment like a Costco warehouse, it can potentially lead to a really negative reaction by the individual wearing those devices. I can't stress enough how horrible of an idea that is to do that to somebody who is having hearing difficulty. But I digress. At the end of the day, it turned out that he's like, yeah, I really don't think that you should treat your hearing loss. And here she is like begging for help from a hearing perspective, right? And if it's not treating the actual hearing loss, at least get her referred to someone who can talk to her about auditory processing disorder if you don't think that hearing loss is the reason why there's difficulty there. And basically she just gets sent home after having this really bad hearing aid experience and without a solution to treat her hearing loss. Fortunately, there's enough videos that are online, a lot of them by me, some of them by other individuals who are sharing really good quality information on YouTube and other platforms. And I think it was her husband who actually found out a lot of this information. And so her husband's like, why don't you just go and give these guys a try? And these guys meaning Applied Hearing Solutions. So they come into the clinic and she's like, I have difficulty hearing, I need help. I've been to a couple of places. One of them, was kind of like high pressure sales of hearing aids. Didn't get a good feel for that because they wouldn't really share any information and they only had like one brand of hearing aids to sell. And then the other place was Costco and they said that I didn't need hearing aids, basically. And so the individual comes back into me and I'm like looking at this audiogram, and when she told me that she was told that she did not need hearing aids. Now, keep in mind, I understand that different people perceive or remember different information from different places, but her husband confirmed that it's like, yeah, they said that she did not need hearing aids. So here we are in a position where I'm like, I'm almost in shock because I'm seeing this high frequency sloping hearing loss, and this is like the #1 hearing loss that needs to be treated with hearing aids, and it can be treated extremely well with hearing aids, because when you just need to blend in the mid and high frequencies, now if you do it incorrectly, it can be a horrible experience, a la what she experienced at Costco. But if you do this really well, someone goes from like, I can't understand what people are saying to like, I can understand everything, I can go into a background noise situation, and now that I have access to these high frequency speech components, I can separate speech from background noise substantially better. And it is like the epitome of an individual who would gain benefit from the use of properly fit hearing aids. And it took me probably about an hour of not necessarily convincing, but educating her to help her understand how and why hearing aids would actually help. And when it came down to the very end of the appointment, she had actually asked me, is there any doubt in your mind that hearing aids would provide me benefit? And my answer was simply no. there is no doubt in my mind that she would gain substantial amount of benefit from hearing aids. And, you know, my clinic, I pride our clinic off of obviously following best practices, but our treatment success rate, so this is the amount of patients like who come in, they get treatment, and then they ultimately keep the treatment and rate their treatment as being extremely successful, is over 99% in our clinic. That means that less than one individual out of 100 would actually do treatment and feel like, yeah, this isn't working for me, I don't want to do treatment. And keep in mind that my clinic gets extremely difficult cases of hearing loss to treat typically, because a lot of people go other places and are like, yeah, we just had a horrible experience there, or I had this type of hearing loss, they said they couldn't help me, or so on and so forth. So we get a lot of people who have gone through treatment at other places and did not have success, and we've got to figure out how to get them success. And I know that this sounds self-serving, and I apologize for that, but this is a message that you need to understand. There are clinics out there. So let's back up a second. From a Costco perspective, I don't want to think of it this way, because I do think that Costco does a lot of good for a lot of people who have affordability and potentially accessibility issues from receiving hearing treatment, right? You can get hearing devices for a pretty low cost and then a decent level of care. In some cases, not so decent in other cases, and good in some cases, right? So I hate to think of it this way, but anytime that a hearing care provider, and they, you know, I mean, the hearing care providers at Costco do not make a ton of money, right? They just don't, right? And compare it, they maybe have good health benefits and other benefits, things like that. But in the grand scheme of things, from a salary perspective, Costco audiologists and Costco hearing instrument specialists do not make a lot of money, and they are not incentivized to dispense hearing aids. And that, it makes me wonder, is like, is the incentive structure for a Costco hearing care provider, is it good enough to make sure that they actually want to do things the right way and do it well? I don't know if it is. Now, if you are a Costco provider, if you could share what your incentives are for actually doing the right thing for patients. Obviously, I don't think that money is a good incentive. I think inherently you just have to want to do the right thing by a patient. And, you know, but I kind of feel bad for Costco providers. I feel like they are oftentimes not valued very much, because Costco does not charge a whole lot for hearing aids. I think that they are overrun with patients. They don't have a choice. Like, they have to turn the patients in and get them out, right? That's how it works. And I do think that a lot of them, their desire to help people is in the right spot, but I'm not sure that the way that Costco is set up that they can actually do that. So I don't know. At the end of the day, this individual elected to pursue treatment at our clinic, and I am extremely looking forward to having her indicate on her subjective outcome measures that she is doing fantastic with hearing aids, and I would bet my state license on it. That is pretty much what I wanted to talk about today. You know, what it really boils down to is that you have to have a hearing care professional who is willing to treat your hearing loss, who is willing to listen to your difficulties and recommend the right thing for you. And even if you, no matter where you go, whether it's Costco, whether it's a private practice, or no matter where it is, an ENT clinic, a hospital group, whatever, you have to make sure that you're going to someone who actually cares about you and your hearing loss and is willing to commit the time to follow best practices, to see it from beginning to end and treat your hearing loss the right way. And so that is really the point that I wanted to get across today. But that is it for today's video, guys. I hope you enjoyed it. Let the bashing of Dr. Cliff from everybody who's a fan of Costco commence. And as always, I'll see you next week.